Diabetes has been one of the top diseases in the country, affecting 4 million Filipinos and a large number who is unaware that they have the disease. Diabetes is also caused by the desensitization of the pancreas to the blood glucose level in our bloodstream. You may know about how diabetes is acquired and the symptoms it manifests, but today, let us talk about how to prepare and what to expect with the different laboratories associated in diagnosing and monitoring the disease. One of the most common laboratories a doctor would suggest is the fasting blood sugar, or as we know it, FBS. As the name suggests, fasting before the blood test is important. Do not eat or drink anything for 8 to 10 hours. We advise that you start this process at around 10 p.m. and then have your blood test taken at 6 a.m. The normal results for FBS is less than 100 milligrams per DL or 5.6 millimole per liter. Another type of laboratory for diabetes is random blood sugar or RBS. This test differs from FBS as this test can be taken any time of the day. However, these tests are taken by most diabetics before meals. Self-glucose monitoring is also considered as a form of RBS testing. This test does not require any preparation. The normal results for RBS is 80 to 140 milligrams per DL or 4.4 to 7.8 millimole per liter. HbA1c, or glycated hemoglobin, is another form of lab test for diabetes. However, this measures the blood sugar level for the past 2 to 3 months by measuring the amount of glucose attached to a hemoglobin. There are no preparations for this. The normal result for HbA1c is between 4% and 5.6%. Oral glucose tolerance test, or OGTT, is used to help the doctors diagnose diabetes among pregnant women. There are 3 types: the 1-hour, 2-hour, and 3-hour tests. Patient should fast 8 to 10 hours before the test and should not eat or drink anything from the specified time. The patient is first drawn blood and then have her to drink 8 ounces of a syrup glucose solution that contains 75 grams of sugar. After 2 hours, a blood specimen shall be drawn to test again. Another way to do this is by drawing blood first and ask you to consume a glucose solution that contains 100 grams of sugar, and then blood will be drawn every hour for the next 3 hours. Results of greater than 92 milligrams per DL at first draw, 180 milligrams per DL after 1 hour, and 153 milligrams per DL after 2 hours is indicative for gestational diabetes or diabetes during pregnancy. These are just few of the laboratories taken for suspected diabetics or those identified with the disease. It is important that you will be able to monitor your laboratories. Applications like MyLabs help patients and laboratories to maintain a record of these results, thus helping them to manage the disease. Ask your laboratory on how to get MyLabs, and for the laboratories, you may contact us at www.mylabs.ph or email us at info@mylabs.ph for more information. Until next week.